Hey everyone, how's everyone doing? I hope everybody's doing great today. And I am here again today to talk to you about something different from what I usually talk about. I know I very briefly said a few words a few months ago, and I promised to come back to the channel and talk about my experience a little bit more, but somehow that never happened. And of course, what I'm referring to is my vocal cord surgery. So a little bit about the surgery itself or the issue itself. What was it that led me to seek guidance in regards to my vocal cords? Okay, so I used to be a classroom teacher many years ago, and I would say it didn't really start with my profession as a classroom teacher. It started before that with misuse of the voice. And, I always said, I'm someone who speaks really loudly. So this didn't start overnight. I was always like this. I conducted myself and conducted my voice in that kind of manner. I would always speak very loud, speak over other people, try to, fight off other noises, like all that background noise and other, if I were as if you were in a crowded room, kind of, and other people are talking, and, you always have to speak loud so other people can hear you. That kind of a feeling. I always had that feeling, and I always had the feeling that I had to project my voice. Of course, this was made worse when I became a classroom teacher, because teachers are forever projecting their voices. And when I was a classroom teacher, I noticed after maybe a year or so that every Friday I would end up really hoarse. My voice would be very, very hoarse. And over time, I realized that I had to seek guidance and I had to look for medical advice. And I was told, you need to go to an ENT for that, an ear, nose, and throat doctor. So I did. And at that time, it just so happens that I had a nodule in one of my vocal cords. And a little bit after that, that nodule became two nodules. And it didn't get any better just because I was really bad at putting good voice practices into practice. I went to speech therapy for a little bit. It wasn't really successful for me, except for maybe a couple of different pieces of advice that I was given. But for the most part, I kept doing what I was doing. So I didn't feel much of a difference, to be honest. So now fast forward a few years, and I want to say probably about 15, 20 years. And I go to a different ENT for an unrelated issue. And I don't want to mention it to him, but he says, you have a polyp, not a nodule or two nodules, you have a polyp in your throat. But to my surprise, he wasn't surprised by it, or he wasn't horrified by it or anything like that. He saw it as something, it happens, a lot of his patients come to see him because of this. So it was nothing for him to be like super concerned about. And he told me, polyps are usually benign, so, but I can hear it, and you have it, so maybe we need to do a follow-up. Fast forward a few years, and my voice is sounding terrible. And I go back to this ENT who puts me on a treatment because I was really sounding terrible. He doesn't even mention the idea of surgery. And I should backtrack a little bit. My first ENT mentioned surgery right away. I ran away from that ENT. I was really, really afraid of surgery, and especially surgery of the vocal cords. Very, very scared of it. But I was afraid of surgery in general. Now, lo and behold, at one point, I had to have a minor intervention. One of my biggest fears of surgery was anesthesia. And when I had this minor intervention, I had to have anesthesia. And I lost a little bit of a fear at that point. Didn't mean that I wasn't afraid of the surgery. I was still afraid of the surgery. So when this happened, I did the treatment that he put me on. I never went back. Got better, really got better, but never went back. Actually, I did go back one time. And he said, well, the polyp is still there. And, you can't consider surgery if that's something that you want to do. But the best course of action for this type of polyp, do not have any more recurrent issues, because I would be extremely hoarse every so often. So the best way to avoid that was to really consider surgery and have that polyp removed. So about a year after that, and this was, I want to say, the end of 2019, I went back. And because at this time, I wasn't as afraid of surgery because I had that minor procedure done. And I wanted to see, the first time I wasn't really considering it, to be honest. Now, this time, I'm a little more open to the idea, right? So I wanted to go back and ask about the surgery. To my surprise, he said, let's do the treatment over again and see if this time it works. He put me on treatment, didn't work, went back, and he said, go to my speech pathologist and we're going to do, I think, a much more thorough exam. I can't remember. This was a stroke test. It was a stroke test that the speech pathologist did. And the speech pathologist, when I did it, definitely concurred and said, surgery is the best course of action. By the time I did that, it was February 2020, and we all know what happened in March of 2020, right? So pandemic hit. My appointment with the surgeon was canceled. So I never got to consult with the surgeon until about beginning of June, I believe it was, or end of May of 2020. And at that point, I saw the surgeon, he concurred. And at that point, when I saw him, he said, this is not only a polyp on one side, it's starting to affect the other side, and you're starting to get a little nodule on the other side as well. So he said, I recommend that you really consider this. We talked about the post-op because the post-op could be very difficult, could be weeks without talking, but it wasn't really as bad. It was, I believe it was like a week and a half, 9 days of no talking at all. And then very little after that. So I had my mind made up. So at that point, I said, okay, what I didn't think would happen with all the backlog of surgeries due to COVID-19 would be that the fact that the surgery got scheduled almost right away. My surgery was scheduled for June 22nd, 2020. So in less than a month, I was having my surgery. And that's when I started getting nervous. And I think this is why I wanted to do this video. And I wanted to tell you that if you are thinking about the surgery, it's not as horrible as you think it might be, okay? And as a matter of fact, the no talking really wasn't that hard at all. I thought that would be the most difficult part. It wasn't, and I'm going to tell you more about it later. But what I wanted to tell you is I kind of like give you a brief story of how and why I went into the surgery. So this was years in the making, but finally I made the decision. And am I happy I did it? Yes. Was it all that I wanted it to be? No. And I will tell you why also in a later video. But there's a caveat to that. So I want you to stay tuned. I want to tell you that if your surgery is coming up, you'll be fine. Trust me, you'll be fine. And the no talking, that was actually kind of like a break for me. So to be totally honest, I love that time. I got to do so much writing. I love writing. So I did all that writing and I loved it. So I'll see you on my next video and I tell you more about the day of the surgery itself. Bye.